Welcome to the latest episode of Equality in Housing. I'm Gareth Young from the UK Collaborative Centre for Housing Evidence.
And I'm Pedro Cameron, newly from the Tenants Information Service, formerly of Housing Options Scotland, but now in a new role with TIS.
On today's episode, we are delighted to welcome Professor Vikki McCall from the University of Stirling. Vikki is a Professor of Social Policy and her work focuses on housing, ageing and stigma, and much of her work is done in collaboration with frontline workers, service users, volunteers to help improve policy processes and policy outcomes. Today we are delighted to welcome her to the podcast to talk about her latest project, funded by the Economic and Social Research Council, the Intersectional Stigma of Place-Based Ageing, the ISPA project. So welcome Vikki, we're delighted to have you join us.
I'm delighted to be here. Thank you for having me.
No, it's our pleasure. So Vikki, just to kick off with, could you just introduce us to the ISPA project, please?
I can indeed. And thank you for giving it its full title. It is a bit of a mouthful, Intersectional Stigma of Place-Based Ageing. But we do just call it the ISPA project. But this is the project of all projects. We'd been working up to this for quite some time. It was a very ambitious project and it's over 5 years. And we've just reached our halfway mark within that 5-year project. And there's a lot going on. It's a mixed methods study. We're going to be doing the numbers. We're also going to be doing the stories. But at the heart of it is understanding how the housing sector and how we can all tackle stigma, especially in relation to age, disability and place. And the idea is this will provide really nuanced insights into the structures and the systems that drive exclusion and allow us to tackle the inequalities that are often experienced, I'm afraid, by older and or disabled adults.
Great, thank you, Vikki.
So, let's get started with what you've found out so far. What are some of the key barriers, that older people are experiencing in terms of their housing and surrounding communities?
Oh, so many barriers, I'm afraid, that we've found. So the project itself is split up into a different series of work packages. So the first thing that we're exploring are, the high level numbers, the big patterns in society. And this is throughout the UK, Scotland, England and Wales. But what drove that, and what I don't have to tell you, is that of course there's a geographical element to this, and we are driven by this need to tackle place-based stigma. This is when places are very unfairly labelled as problem places. And then often people within them are then labelled as problem people. And we know that's a powerful process. It's usually concentrated in our more multi-deprived areas. So just for example, for Scotland, 42% of people that are living in our more multi-deprived areas are disabled. So there are concentrations and different barriers and different social identities and groups within different places experiencing multiple barriers. And we're looking at those patterns first because we know we need to look at those, and we unfortunately do know there's a connection with multiple deprivation. And so we'll give you some maps very soon on this that overlay kind of multiple deprivation, ageing and disability. But we're also looking at a work package which is about the lived experiences. And at the heart of that, we've built an army of community peer researchers who are older or disabled or disabled adults throughout Scotland, England and Wales. We're working with about 140 peer researchers at the moment, and they are giving us diaries of their day-to-day lived experiences over a 2-year period. So can you imagine the beauty of this database that we're building that gives us evidence upon evidence of these barriers that people face every day? And I'm afraid it's actually hard to narrow it down. There's just so much ageism out there. There's so much ableism, and there's also experiences of stigmatization because of where people live or the tenure that people live in, like in social housing. And it's just so unfair because the perception of these places and experiences are so different, and people want to tackle that. But practically, the barriers are often around the aesthetic, being offered maybe the wrong adaptations or ugly adaptations that are counter to people's identity, or not being offered adaptations or home improvements at all. Lack of contractors, lack of funding, lack of everything that actually helps us tackle stigma in a tangible way. within our communities and our homes. May I give you an example?
Yeah, please do.
So I think one of the more common ones that we gathered in the evidence that people really detest these white PVC handrails when they're offered as adaptations. And these are just, stuck on to the front of people's homes. And what people feel is then that's a marker of difference, a marker of exclusion. It tells people, hello, I'm disabled or I am older in their community, and people really detest them. And in fact, they would rather do without the help than have these stuck on to their homes, even though they may really need it for mobility challenges or, these normal things that happen as we grow older, just a little bit of support that we need. So we're testing out ways in which we can do these adaptations that tackle that stigma, that exclusion, such as beautiful handrails that are made by Invisible Creations, one of our partners, that look like flower boxes that everybody would have in their home. And it doesn't wave to everybody that you're different. And most importantly, it doesn't attract scammers to your door.
Right. Yeah. Okay. And so are you looking at, are you looking at any other kinds of intersections, or are the main ones kind of age and disability and the sort of deprivation sort of?
Yeah, that's our starting point. Absolutely, is place, age, and disability. But what we're finding just naturally is other intersectional identities come up. We have a big group of peer researchers who have different social categories. And in fact, our co-investigator, Kim McKee, is currently doing a case study on women in social housing, specifically looking at older women's experiences, especially in creating and being part of the movement of starting housing associations, which is really exciting.
Thank you.
Yeah, that's really interesting. Could I just pick up on another point just before we kind of move on around this community peer researchers, the group that you're talking about that you've built up? Because, I mean, I was looking at something like 140 people that you've got involved, which is incredible. I know from conversations I'm having, especially doing our EDI work, both across academia, policy, practice, that obviously it's really important that we're engaging with the people where we're trying to kind of implement good policies or practice. Could you just talk a little bit around that process of like how you went about starting to recruit people and kind of that building up of the trust to get people involved, just for people listening?
I absolutely can. And co-production has been very much at the heart of a lot of the work that we do at Stirling University. And a lot of coffee and cake is really the key to it. Absolutely engaging at the grassroots community groups, older people's groups, working and building trust through sharing people your vision, getting them on board and finding people that share the vision with you, that want to make a difference. So a lot of the people, 140 people that have signed up to this project, want to see us make real change. Often it's tapping into the things that they're passionate about. We also have a big list of partners. We're working with the University of St Andrews, Bristol and Newcastle. We're also co-eyes with the Scottish Federation of Housing Associations and the Housing LIN. So we utilise these networks first and foremost. We try to tap in to already existing groups, but a lot of it has actually just been travelling across the country, meeting people as passionate as we are about accessibility and flexible housing, letting them know us and us getting to know them, finding common ground and joining the movement.
Yeah, and I think that's the thing, isn't it? When you talk about it in that sort of framing of a movement, joining, kind of working together, because I think just from experience, and I'm talking a little while ago, I know co-production with academia has kind of changed and developed, and we're getting a better understanding of what to do. But there were certain groups of people I've spoken to in the past, particularly when you're going in and doing research around homelessness and things like that, where people are just exhausted of participating in interviews and being researched on rather than with, and kind of, or not going back and talking to them about the findings. So it is about that journey, isn't it? Kind of taking them on and being part of a project as collaborators.
In collaborators and equal partners, absolutely. Because our peer researchers are an integrated part of the research design. So, for example, when they're doing their diaries or we're sending out questions, we've already had co-production meetings setting out them helping us actually create the questions, the way that things are asked, the way they're sent out, and indeed the way they're replied to as well. We have ongoing focus groups and peer support networks that kind of integrate co-production, and they'll be a central part of the analysis. So nobody will be surprised, being one of our CPRs, of what's coming out of this project, because they've been with us every step of the way.
Oh, that's great. Thanks, Vikki.
And what's the sort of what's the spread, across the UK in terms of the peer researchers? So, and are you seeing differences? I mean, at this stage, in terms of the data that's coming through.
Oh, that's an interesting question. And the majority, about over half are in Scotland. And that's just because of the nature of our networks and being based here. And it's mainly been myself and our research fellow, Dr. Diane Theakston, who has a visual impairment herself, who have been going around. We've been going around the country. So the majority in Scotland, but we have really healthy, wonderful CPR groups in the north of England, also down south in England and in Wales. Mm-hmm. The challenges and the barriers, which was central to your question, have been very similar across the board, to be honest. I wouldn't have said there's too much divergence, except for maybe in the nuance in terms of what people are entitled to around adaptations and the way that they're delivered. Because actually that's just complicated also in Scotland, because it changes between tenure, never mind how it's different in England and in Wales.
Yeah, I was just thinking about in terms of the differences in legislation and particularly in housing legislation, but also in healthcare and things like that, whether that's impacting on whether we're going to see a big difference in the way that things are being delivered. But sounds like it's a pretty common thread of societal things that are contributing to the sort of discrimination and the sort of the challenges that people are facing, and I guess that comes with this idea of home, which you talk about, and the sort of intersection between housing and the idea of home is kind of it's a universal thing rather than a sort of a devolved thing, shall we say.
I'm afraid so. I think the barriers that we've seen are very, very similar, although I think the routes to support, we see more divergence.
Great, thanks.
No, that makes a lot of sense. Just thinking about some of those sort of challenges and barriers that you've outlined, so things around ageism, ableism, choice, the persistent issue of stigma. Who would you say has the kind of power or leverage to start making changes? I mean, I know that's a huge question. You're still only kind of halfway through the project at the moment, but kind of which stakeholders are best placed to make effective change, and can any one type of organisation or stakeholder say make a difference? So
I think that's a good question, and the answer is really we do need to make differences at multiple levels, and what we've done to try and make that change, and the second part of the project is about making that change, is we've brought together an inclusive living alliance, of which we've got around 45 members in this alliance, and that's a big range of stakeholders. So it includes, at the moment, for example, foundations down in England. It includes Alacho up here in Scotland, Care and Repair, Public Health Scotland, and Housing Options Scotland, hurrah. And we've got Build, ProCare, MotionSpot, and the actual designers of inclusive design as well in here, as well as people who deliver. The list goes on and on of our amazing stakeholders that are in our alliance. So what we found where the magic is bringing people together with innovative solutions and the people who can then deliver that. So the example I gave earlier was the handrail, and we're working, our first kind of case study is with Horizon Housing Association, and they're working with Invisible Creations on these beautiful, the ones that they've designed, these innovations. They're going to implement them, and we are tracking the impact of that from A to B to C, because we are first and foremost want to make real change for tenants. So we'll see how that impacts their confidence, their dignity, their feelings of independence, and see what works. And then the idea is then to bring this alliance forward and develop an inclusive living toolkit, which then snowballs all of this evidence, learning points and good practice further. but also allows us a platform to show local authorities, but also the Scottish Government, the UK Government, and in Wales, the power of home improvements, the power of flexible, accessible, and beautiful design in tackling stigma. And I don't think the housing sector has thought they have a role in that traditionally, but what we've been seeing in this project is we really, really do, because the housing sector has the best chance of making tangible changes to make inclusive environments. And what we're seeing is inclusion is just good for everybody. We are all stakeholders in ageing, so we all have to work together to future-proof our society in these ways.
That's brilliant. Thank you, Vikki. And I guess that as we'll see how it kind of all progresses, but I imagine there's going to be lots that we can learn from this Inclusive Living Alliance that transfers into other areas of housing policy and kind of related policies as well, where you kind of just, because I think this is some of the challenges I've been grappling with work that I've been doing. So things around kind of place-based housing associations' responsibility for employment support, for example, and kind of inclusive economic improvements in certain areas. And it's like, there's so many different stakeholders who should be involved, but it's how do you kind of coordinate that and get everyone to sort of see the benefits of working together? And it's a huge challenge. So I imagine there's going to be a lot of kind of learning points from this about kind of how these sort of multi-discipline groups can kind of come together and work effectively for better change for communities.
Absolutely. And I think it's just reminding everybody we're all going in the same direction, and we're all growing older.
Yeah.
We all want to build housing and inclusive environments that are going to support us as our health needs change and whatever surprises come around the corner. And I think it's almost trying to convince everybody of that first, that cultural piece in a way, and that what we can do can tackle these, really negative experiences that we've captured around people being treated badly because of their age or their disability or where they live.
Yeah. Thanks, Vikki.
Yeah, great. Thank you, Vikki. Now, we kind of want to sort of open things out a little bit with and sort of talk about, there's a relatively new UK government in place, and housing seems to be like quite a big priority in their plans. So are you finding a sort of more positive or a softening attitude to sort of towards issues of exclusion? And do you think that moving to a person-centred approach is going to be easier moving forward?
Well, I'm forever hopeful. I'm definitely a glass half full kind of person. And I do think, though, that we do need to start questioning our housing policies in a bit more detail. And the overriding focus is often on how many. And I think the new question is really about quality. Is also like we may be building these homes, but how long will they last and who can live in them, especially with an aging demographic and increasing levels of disability in our society? Are we building the right homes that will last the piece as our aging demographic shifts in the future? I mean, the housing sector has been accused continually by the House of Lords in particular of being woefully underprepared for the ageing demographic. So I think these are really tough questions. I always call it really difficult for politicians because we're talking here about the tomorrow problems in some ways, that future-proofing piece. But actually, if we don't start to integrate and future-proof our housing stock now, make it as accessible as we possibly can, these are going to be really more acute challenges in the future. And don't get me wrong, right now there are people in homes of which there's parts of their homes they can't access. Right now, people are living without access to bathing facilities. They're living without being able to cook within their own kitchens, and some of them can't even leave their homes. So these are the realities of life, that some of our homes are just non-decent.
With the white PVC handrails and things like that, that sort of accessibility isn't, like, the design hasn't caught up with it, or the sort of affordable design and attractive design doesn't seem to have caught up with sort of accessibility requirements, or proofing homes. That seems to be kind of an issue. So people don't want to live in accessible homes, because it's not, to their minds, that it doesn't look nice. Yeah.
Yeah, because of the power of stigma. And it doesn't have to be that way. And in previous projects, when we were looking at designing homes for healthy cognitive aging, DECA, we were working with professionals, and you're like, would you, oh, that house is for somebody with dementia. Oh, that housing's for somebody with a wheelchair. And they're like, would you live there? And they would say no. So, why aren't we building and integrating inclusion, beautiful design that makes people feel at home? And there's a real business case for that as well that I would put forward, because say you're a housing association and you're thinking about your demographic of your tenants in 10, 20 years' time. If you started introducing beautiful wet shower rooms that don't look like they're, and I use this with, my hands up in the air, older people, or that don't look like institutions, and you start integrating beautiful design and beautiful handrails that are just subtly making your homes more supportive, what you're going to do is increase tenant sustainability. People will be able to live in those homes longer. So that reduces your void costs, that reduces your repair and maintenance costs. So there's a business case as well as an ethical, moral and social case for focusing and putting forward of central importance, accessible, beautiful and flexible design in housing that tackles stigma.
I think that's so right. And I am sort of always a bit of I'm always an advocate for that. Is like, there's, of course, we have like a sort of a moral, ethical kind of duty to, make things as accessible and, and as inclusive as possible. But actually, to my mind, what seems to be missing is that, like, let's put a cost on that, and like, let's put a cost saving on that, and sort of, look at that economically. Because that's the reality, particularly, housing associations and social landlords, are short of money, in a lot of cases, particularly like community based landlords, etc. So you've got to sort of make the economic case, the business case, as you say, as well as the and there is one, and quite a solid one, I would say. So yeah, I think
it's about the decisions being made at the right time. So in our inclusive living toolkit, we give the example of, this is my favorite one, the plug at the bottom of the stairs. So when you're building new homes, and also when you're doing your repair and maintenance cycles and electric upgrades, put a plug at the bottom of the stairs so that later on, if a stair lift is ever needed for that tenant, the electrics are done and it reduces the cost and the hassle by about a third in installing that adaptation. So, and what does it cost you if you do it while it's being built? Nothing. It's a cost neutral intervention that makes it more accessible later in the day. But it's also a handy intervention for hoovering the stairs. Design is good.
Yeah, totally.
No, that's good. One thing I've just been thinking about, Vikki, as we've been talking, but this actually, like a lot of what you're talking about and the issues here do apply across different housing tenures as well. So it isn't just central housing, is it?
No, we're looking across tenure for sure. Home ownership, private rent and social housing. The barriers, are similar, and the experiences are similar as well across the piece. I'm a little bit worried about the emerging group of older homeowners in more value properties, maybe often linked to right to buy properties as well. That haven't been maintained for a long time. So the roofs, the windows, and very cold, very rundown homes that, there's very little options for people later. And a lot of these homes maybe, well, I've been in a lot of them and there's only maybe one room being used, for example. And when something happens in terms of a health challenge, and most people won't have adaptations until something has happened, some kind of health crisis. It's all very reactive. But often they'll find the only options are to then go on to the waiting list for social housing. And that's, it de-empowers people. It's maybe not their aspiration to be in their own homes, but they've not maybe thought about this in time. There's some real challenges. At the heart of it, a lack of housing options. we need more.
Yeah, no, absolutely. And I imagine as well also, and this is kind of going off the point a little bit, but with things that we've seen, kind of the increase in material costs and building costs are obviously kind of making adaptations more tricky for kind of home improvement agencies and things like that, which everything's just getting harder and harder, isn't
it? It is. And contractors have come up as a real challenge in especially rural areas and Scotland as well, the costs of materials. But I would have said the most recent challenge was the proposed cut in adaptations and then the big delay in adaptations funding. So that uncertainty doesn't help the process of adaptations being put in place.
Well, that's been great, Vikki. Thank you very much for kind of talking us through all of the work that you're doing. And we will make sure that we link to the project pages, because there's tons of resources and blogs written by your kind of community peer researchers and all sorts on there. So we'll make sure that we kind of link to that and kind of highlight all of the work that you're doing there. Is there anything else you wanted to kind of add or say before we wrap up today?
Only that I think what we have here is really exciting, and there's so many motivated and enthusiastic services out there doing an amazing job in really challenging circumstances in this area. It's almost a miracle we're delivering what we are in the housing sector. What I would love to see is that, that sweet spot of finding really great partnership work with health and social care, because the benefits of this approach of making accessible housing that really tackles ageism and ableism and exclusion, it means that it benefits health, it benefits social care, and it benefits our housing stock in the long run. And it's about just getting on board with that vision and that idea of prioritising accessibility in a way that will tackle these powerful processes of stigma that, make life a little bit difficult for many groups.
Brilliant. Thank you so much, Vikki.
Yeah, thank you, Vikki.
Thanks for having me.
A huge thank you to Vikki for joining us today. It was great to hear more about the brilliant ISPA project. If you'd like to find out more or explore ways in which you might be able to get involved, the project website will be in our podcast notes for today's episode, as well as some other links to things that we discussed today. Thank you so much for listening, and we look forward to the next episode of Equality in Housing coming very soon.